Good evening, everyone. My name is Michael Cooley of the class of 2019. Thank you all for coming to watch this video. We are here at the Philadelphia College of Osteopathic Medicine, Georgia campus, American Society of Health System Pharmacists, Student Society of Health System Pharmacy, Clinical Skills Competition Formatting Review. And I hope you enjoy this video. Let me introduce myself briefly. My name is Michael Cooley, and here at PCOM Georgia, I'm the Student Chapter President. I'm currently a P3 working with faculty and staff to provide an overview of the Clinical Skills Competition formatting. All the information found that I'm providing can be reviewed in the Clinical Skills Competition Student Handbook of your current academic year. This is just a reminder of the legality, and although it's assumed, I would like to make it explicitly clear. My opinion doesn't reflect in any way the views of the staff and faculty, the school, or of ASHP. We as a school have no financial ties to disclose. This information is not sponsored by ASHP, and in any circumstances, this material should not be used as medical advice. Next, we begin to look at SOAP notes. To begin, we would like to state that these sessions are our first here at our student chapter. We kindly ask that you leave your comments and concerns on how we can improve the material provided. The information regarding the SOAP note formatting will be covered in depth with each case. It is important to note that there is more than one way to accurately produce or make a SOAP note, but the key is to have methods that provide consistent results. On this slide, we provided the formal references that will be used at the national competition. It is important to note that each local chapter will have different regulations on which material will be allocated to the competitors. Each one of these materials will include a subject in therapeutics, drug information, drug interactions, interpreting laboratory data, general medicine, and/or pharmacokinetics. On this slide, or as you look through this slide, I hope that it provides each student an understanding of how ASHP formats their casing. Here we can see that infectious disease predominates, followed by cardiovascular, and then endocrinology. With this review, I hope it gives students insight on the material that could be presented in the future. Okay, let's go ahead and break down the clinical skills competition. First off, what is it? It's a 2-hour competition focusing on the Pharmacist care plan, or SOAP note. It is important to note that nothing else on this case will be graded besides your care plan. Using this plan is your responsibility to serve the patient's medical needs. The next part of breaking down the clinical skills competition. How does it work? You will register in teams of 2, but here at PCOM we work diligently to pair individuals that are unable to find a partner. See your local chapter for the details. Your team will be provided printed references along with Lexicomplete or Lexicon. And please develop your own preferences and searches to the references provided, utilizing your team of 2. Okay, let's go ahead and utilize your team of 2. And your question is, how can you utilize them? Obviously, practice cases are optimal, and more than practicing is developing your teamwork. Being able to communicate ideas and strategies is more important than your individual knowledge. Develop each teammate's goal in order to become efficient and avoid overlapping work. Where do you look? Where do you look for your answers is the number one question we receive, and the number one answer that we always give is to develop your own strategy. The strategy I personally implement is to define the problems with a prioritized list. And that's always going to be what is my most acute problem, how is it diagnosed, what are the signs and symptoms, and what are the comorbidities associated with it. Once you have your list laid out, treating it is easy. How will I be graded? And I'd like to go into detail, but due to the time constraint, please refer back to your academic year Clinical Skills Competition Handbook. Let's dive a little deeper. Let's talk about how to develop your own pharmacist care plan. And the most important thing of any plan is to make sure you have a prioritized list. As you'll see, there is only one most acute problem, and that's because it is fatal or can cause serious harm to the patient unless it is treated immediately. Next, we have number 2 problems, or things that must be treated within the visit, and there can be multiple of these. And lastly, our number 3 problems, or things that can be assessed and used during a follow-up or at a later date. This is the second part of developing your pharmacist care plan. Every single problem must have certain elements to it, and this I've defined with the acronym Mr. T. And I say Mr. T because he was part of the A team, and in this case, Mr. T will give you the A plan. T as therapeutic goals. They're not specific or measurable, but focus on the point of the treatment. R are your recommendations of the therapy. Those include your prescription and your non-prescription, using your reference materials for these answers. And lastly, your monitoring and your therapeutic endpoints. Utilize specific and measurable goals, such as your labs, quality of life, and your vitals, etc. To develop the pharmacist care plan any further, let's take a step back and look at the SOAP note. The SOAP note stands for your subjective, objective, assessment, and plan. Using your own acronyms to develop your style, but here I will list the formatting that I use. This is the subjective, and it's exactly how it says. It's not based on diagnostic criteria or clinical presentation, but rather with patient narratives and clinician impressions. For this, I've used the acronym ALL/FM, and for the social history, I will give you one more acronym called FED Tacos. FED Tacos is going to be an odd acronym for you, but it is the only way that I found to make it applicable for me to remember the social history. FED Tacos being your food, exercise, drug or your illicit drugs, tobacco use, alcohol use, caffeine, occupation, and sexual relations. And the only reason I can remember it is because I get tacos in my social life. Unlike the subjective, however, the objective only focuses on items with specific and measurable values. For this, I've given you the acronym VAPE, or literally the object, a vape. It is important to note that some points may be listed in the subjective or the objective. In this case, it's going to be your prescriptions. If a prescription comes from the patient narrative, then it is listed as subjective. If you are, however, able to get physical records from the pharmacy about the prescriptions, then it becomes an objective measure. The assessment should only be done after completing your list. And although it's not necessary, I always mark whether the disease state is acute versus chronic, and uncontrolled versus controlled. This gives me a reference point to determine the severity or how acute a problem may be. Lastly, we look at your plan. And for this, I would like you to use your sources that work best for you. We're going to refer back to Mr. T, which what does it stand for? That's right. Your monitoring and your therapeutic endpoints, your recommendations of therapy, and your therapeutic goals. I thank you today for your time, and please leave your comments and concerns on how we can improve these sessions for you. Thank you.